other countries. So when we are trying to get support from the international, first of all, maybe you need to have some friends in the nearby country. We'll utilize maybe in Hong Kong. Another important thing I think in Taiwan is that because mainland China is raising up at this time, so another important factor you are going to maybe you have to convince mainland China to be supportive. And at the meantime, what we have done is that we have done something for mainland China. We visit mainland China many times and to build up relationship and friendship with their leader. And then we are trying to pursue them to support Taiwan for this meeting. And I think the overall environment now is good for Taiwan to have such meeting. So I think that before bidding, we have to do some work between our friends and to talk with them, please support Taiwan to have such a meeting. This meeting, we have so many people coming from different continental. We have people coming from North American, South American, and also from Europe and from Asia-Oceanian countries. Totally, we have 40 countries to join this meetings. Up to date, we have 1,600 attendees to join this meetings. And I think this is a kind of cooperation of continental. We are doing very well in medicine, so we must let the international know what Taiwan is good in medicine, because it's very good for Taiwan, because now we are trying to spread things out. We should have recruit people outside to have medical care and examination in Taiwan. So it's very important for us to hold such a meeting to let the international medical society to understand the ability of Taiwan. We can play also something like a leadership role in Asia country. So maybe we can now we can work with Japan, Korea, and mainland China. We can bring the field of rehabilitation to a higher level through these scientific meetings.
I came to Taiwan about 8 years ago. I was invited as a speaker, and Dr. Lim was the major person at that time, and I was very, very impressed with rehabilitation medicine in this country. The fact that all your medical schools had mandatory clerkships in physical medicine rehabilitation, so that all your doctors learn things that can be done for people with disabilities. And so to me, to come back here and see this country again and see how much more you've done is an amazing opportunity for me.
In KNA, we normally would assign a project leader for the program, for this special assignment. Every project leader has to do very good time management, because they don't only work on one project. So they will work carefully with the organizing committee and work out a checklist, and we follow the checklist and do all the neat deadline preparation. It took us about 16 months to prepare for this event. Well, we worked out a checklist with the organizing committee, and we followed every step. And we would know ahead of time from the checklist and by experience that what would happen. So we always reach out ahead of time. So things went smoothly. If you prepare 95%, it's just that 1% that you missed or oversight, it would ruin the most of your hard work. That's why experience is the key to have a very successful meeting. When you do preparation, you thought you think of everything, but in fact, the on-site action is really counts. So always prepare a contingency plan, which is a plan B. Just like that, we had several speakers didn't show up the last week. The reason was the volcano eruption in Iceland indirectly affected. They were stuck in other meetings, and it made them feel very uncomfortable, and all their work schedule has to be postponed, so they couldn't make the trip. So the speakers, we had a plan B. We invited them, and they came, so everything is under control. Well, this meeting starting out 16 months ago, we had two considerations. It was the Howard Plaza and the TICC. But when time goes, it grew bigger. So TICC would be the only place that we could do it. It's over 1,500 people registered. TICC is built for conference, so it's a perfect choice. Funding has been a big issue throughout the preparation. We seek for help, but when we got this meeting in 2008, it was the economic downturn during that time when we did the funding. So I think funding was the most difficult part. And the preparation went very well because Professor Tang is very famous in his field, and he gets all the support that he gets from all around the world.
I was very impressed with how international it is. I was very impressed with all of the speakers that are coming from the Asian and Australia and New Zealand countries. But I also was very impressed with all the international speakers you have here. And the fact that you have, I think, 100 posters. You have, I'm not sure how many total platform presentations. You have some amazingly up-to-date workshops that you're giving. So I really expect that the doctors that attend this conference, when they go home, will be able to improve their patient care, their teaching, and their research. First, I'd like to say is I'm really impressed with all the information you sent over all the periods of time. The quality of it, the clarity of it, the fact that every question that I asked, people answered very quickly. They were very efficient in answering those questions. And so far, the arrangements have been outstanding. I'm looking forward to this beautiful convention center. I'm looking forward to the meeting. I think everything's been handled exceptionally professionally and probably as good, if not better, than any international meeting I've attended.